Alright folks, in this video let's talk about some of the psychological, behavioral and emotional factors that can cause cataract and see how we can prevent cataract. So just before we start, what is cataract? I have some notes here that I'll read to you. So it's a dense, cloudy area that forms in the lens of the eyes. So a cataract begins when proteins in the eye form clamps that prevent the lens from sending clear images to the retina. And the retina works by converting light that comes through the lens into signals. It sends signals to the optic nerve, and which will carry them to the brain before we can see. So cataract develops slowly and eventually interferes with your vision. So the big question for me now is, what causes cataract, or what are some of the risk factors for cataract? Or actually the behavioral ones, the psychological ones, the emotional factors that can lead to cataract. One is excessive smoking. Again, this is a behavioral issue. So studies have linked smoking to the development of cataract. If you want to prevent your risk of developing cataract, stop smoking. There's a behavior issue. Stop smoking and then you can prevent your risk of developing cataract. Another thing or behavioral factor that has been linked to the development of cataract is trauma. All forms of trauma: childhood trauma, relationship trauma, trauma from every aspect of life, or abuse if you like, verbal abuse, psychological abuse, any form of abuse. So trauma or abuse has also been associated with developing cataract. So why would trauma or abuse be associated with developing cataract? So if we can find ways to deal with trauma, find ways to deal with abuse in our lives, then the chance of developing cataract is going to be reduced. So one thing is that the trauma or the abuse that people go through turns on the body stress response. And like I said, when the body stress response is turned on, all the systems, or almost all systems in the body, do not function as they should. So some more risk factors. Another risk factor for cataract is heavy or excessive alcohol use. Again, this is a behavioral problem. If drinking too much alcohol would increase your risk of developing cataract. Easy solution: stop drinking alcohol and the risk of developing cataract will go down. Being overweight has also been used as a risk factor for developing cataract. So usually stress that will make people gain too much weight. So deal with stress, deal with being overweight, and then you reduce your risk of developing cataract. High blood pressure is also a risk factor for developing cataract. In terms of high blood pressure, stress will make you gain weight, and gaining weight is a risk factor for developing high blood pressure. So if you want to stop high blood pressure from being a risk factor for you developing cataract, deal with stress, try to reduce your weight, and then high blood pressure risk will go down, which will mean that your risk of developing cataract will also go down. Diabetes is also another risk factor for cataract. We know that type 2 diabetes, one of the risk factors for it is being overweight. Being overweight would also start from too much stress in your life. So if we can deal with stress and being overweight, we reduce our risk of developing type 2 diabetes and therefore reduce our risk of developing cataract. So many things that we can do to prevent the risk of developing cataract and therefore improve our vision.